Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of our readers. And the question last week was part 4 of my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy. Help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another frequently asked question from our readers. And the question this week is, how long does a critically ill patient stay on a ventilator after open heart surgery? Many patients are admitted to intensive care because they need open heart surgery or cardiac surgery. Open heart surgery or cardiac surgery is always followed by a stay in intensive care or critical care. Open heart surgery or cardiac surgery is any type of surgery where the chest is cracked open and surgery is performed on the muscles, valves, or arteries of the heart. The most common type of open heart surgery are coronary artery bypass grafts and valve repairs or valve replacements. Most valves that are being replaced or repaired are the aortic valve, the mitral valve, and or the tricuspid valve. Most intensive care units, most cardiac surgeons, which are the surgeons operating on the heart, and most hospitals follow pathways after open heart surgery or cardiac surgery. A pathway basically means that a patient after open heart surgery should tick certain boxes in terms of their progress and then follow that progress until they can leave the hospital to either go home or on to rehabilitation. A pathway basically lays out the best plan there is to get a patient from admission to hospital to the operating theatre to intensive care to a hospital or cardiac ward, rehabilitation, and then home. The pathways after open heart surgery or cardiac surgery often indicate that a patient should leave intensive care day 1 or day 2 at the latest after the surgery has been performed. In order to do so, they need to be off the ventilator, they need to have woken up from the induced coma, they need to be hemodynamically stable with a normal, regular heart rate, a normal blood pressure, and they are meant not to bleed after the surgery. Therefore, the answer to the question, how long does a critically ill patient stay on a ventilator after open heart surgery, is 12 to 24 hours as per the hospital's pathway. Well, that's just one side of the coin, and while it's great to have goals and pathways, the reality shows that those pathways are sometimes not realistic to be followed for some patients in intensive care after open heart surgery or cardiac surgery. Other issues that need to be managed in intensive care are adequate pain relief and or intermittent or permanent pacemaker dependency, which is something that does happen after open heart surgery or cardiac surgery. Furthermore, other complications that can occur after cardiac surgery is that patients are going into atrial fibrillation, also known as AF, or atrial flutter. AF is usually treated with replacing electrolytes such as potassium and magnesium, as well as giving amiodarone or digoxin. Other, less frequently observed complications after cardiac surgery can be wound infections, stroke, poor cardiac function, dependency on an intra-aortic balloon pump, also known as IABP, intermittent or permanent pacemaker dependency. VT, also known as ventricular tachycardia, or VF, which is ventricular fibrillation. Both VF and VT can develop into cardiac arrest and are potentially life-threatening. And I can assure you that after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager for over 5 years, and with now talking to, counselling and consulting families of critically ill patients in intensive care on a day-by-day basis, I know for sure that many patients after open heart surgery are not tracking as per pathway, and that they don't tick all the boxes to leave intensive care after day 1 or day 2 after the surgery has been performed. Therefore, they often stay on the ventilator and in an induced coma for more than 24 hours, and then your loved one is not following the pathway. Chances are that if you are watching this video or listen to the audio version, that your loved one is in intensive care after open heart surgery and they haven't followed a nicely planned pathway that expects them to go back to a hospital or cardiac ward after 24 to 48 hours after open heart surgery. So here's a little bit more background about what's actually happening during open heart surgery so that you understand the mechanics and so that you understand why your critically ill loved one may not be following a nicely planned pathway and why they are still in an induced coma and on a ventilator with a breathing tube. If you or your critically ill loved one is having open heart surgery for either bypass grafts, a valve replacement or a valve repair, your loved one will need to go on a bypass machine. The reason for going on a bypass machine is actually that during the surgery the heart is being stopped, and therefore the bypass machine is temporarily taking over the function of the heart and the lungs. Open heart surgery usually takes a minimum of 2 to 3 hours, but can take significantly longer, therefore increasing the likelihood for complications to occur. One complication with prolonged surgery time and therefore time on the bypass machine is that your critically ill loved one may develop atelectasis, which stands for collapse of the alveoli in the lungs, and that can lead to pneumonia. When your critically ill loved one is on a bypass machine, the lungs are collapsed, and therefore chances are that after the surgery, the lungs will need some time to fully expand again, hence increasing the risk to develop a pneumonia or a chest infection. On top of that, take into consideration that your critically ill loved one had their chest cracked open quite literally, had hours of surgery performed on the heart, and is on artificial life support like ventilation and potentially on inotropes. And you may now have an appreciation that your loved one may not be able to leave intensive care as per pathway. On top of that, there's also a chance that with increasing age and with other significant pre-medical conditions, waking up after the induced coma after open heart surgery might take a few days to wake up. The most common complications after open heart surgery are that there is a delay in waking up after an induced coma. This also often goes hand in hand with bleeding after open heart surgery, as well as hemodynamic instability such as irregular heart rhythms and or low blood pressure. This then also often triggers the use of inotropes and or the replacements of fluids with blood transfusions. Inotropes are actually intravenous medications to support a low blood pressure. If your critically ill loved one is still bleeding after open heart surgery, there's a very good chance they may have to go back to the operating theatre operating room to get the bleeding fixed. This also means that your critically ill loved one stays in an induced coma longer, hence needing mechanical ventilation and the breathing tube longer than actually laid out in the pathway for critically ill patients after open heart surgery. Therefore, if complications occur such as bleeding, irregular heart rhythms, mainly AF, stroke, pneumonia, chest infections, or the dependency on an intra-aortic balloon pump, there's a very good chance that your loved one will need to stay on a ventilator with a breathing tube and in an induced coma for longer than initially planned. Some statistics suggest that up to 40% of patients after open heart surgery or cardiac surgery develop atrial fibrillation or AF. From my clinical experience, this sounds about accurate, as I would think that about at least 1/3 of patients after open heart surgery develop atrial fibrillation or AF. AF doesn't necessarily keep your loved one ventilated and in an induced coma, but it may lengthen their stay in intensive care depending on whether their blood pressure is compromised from the AF and if they need inotropes for low blood pressure. The fact of the matter is that if any of the above mentioned complications occur, there is a very good chance that your critically ill loved one will not follow the pathway and won't be able to leave ICU within 24 to 48 hours after the open heart surgery or cardiac surgery. Therefore, depending on the nature of the complications, your loved one may need to stay in an induced coma for longer and therefore also need ventilation with a breathing tube. Until the complications are being managed and resolved, your critically ill loved one will need to stay on a ventilator with a breathing tube and in an induced coma. This can take sometimes days to weeks. Therefore, be patient and don't give up. I know it's not very nice to watch your loved one not recover quickly from open heart surgery. Know that most patients get through this fine, even if they do experience some complications. At the end of the day, any surgery that requires a stay in intensive care has risks attached to it that need to be managed. Irrespective of the complications that may have occurred, to keep your critically ill loved one in the induced coma and on a ventilator with a breathing tube after the open heart surgery, we find that the biggest frustration most commonly mentioned is that their loved one isn't waking up after the induced coma. To address these frustrations and manage them effectively, we have also developed some very valuable other resources that will help you get more information and also manage this situation when your loved one is still on a ventilator and not waking up after the induced coma. So there's 3 resources that you may want to check out, and I put some links to those resources below this video. The first one is you should check out the article, How Long Does It Take to Wake Up After an Induced Coma? The next resource you want to check out is the 5 mistakes you are unconsciously making if your critically ill loved one is in an induced coma and is not waking up. And the next resource you might want to check out is the 10 answers to the 10 most frequently asked questions when your loved one isn't waking up after an induced coma. I really hope this helps, and please just let me know if you have any other questions. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.